My name is John Hare, and we've got a revolutionary treatment for a bacterial infection called C. diff. And you probably have never heard of C. diff, and the reason for that is they cause it. C. diff is a bacterial infection that is typically caused by taking an antibiotic treatment for something else. Next thing you know, your gut microbiome is gotten to the position where you are now susceptible to C. diff. You come in contact with that bug, and you're sick with it. In our case, we've got something brand new that we've experimented with. As a matter of fact, we're in a phase 2 clinical trial right now for treating C. diff with the world's first oral dose antibodies. And what that is we actually have antibodies that normally would be produced by your own immune system to try to fight off an infection or disease. And in our case, we actually get an external source of those same antibodies. So now we can actually target those antibodies directly to the gut where C. diff is causing the problem. Now, why is this a potential valuable proposal? Well, again, as a therapeutic, in other words, curing C. diff, kind of inconsequential. But from the point of view of preventing it, all of a sudden there's a much bigger audience. For C. diff, there's been a couple of companies that tried to come up with a preventive strategy, which, when you think preventive strategy, typically you're thinking vaccines. And the two companies in question are Pfizer, who you know, and Sanofi Pasteur, which is a huge French company. And they both spent probably 10 years and maybe $1 billion each trying to develop a vaccine which would stimulate your immune system to produce antibodies to prevent C. diff if you came in contact with that bacterial infection. Had they been successful, I'm guaranteeing you that everyone would have known about C. diff, because they would have all of a sudden promoted the heck out of the fact that C. diff is a bad thing, which it is. Kills 30,000 people every year, infects about 500,000 in North America alone. Not something you want to get. But unless somebody can come up with something that can literally prevent it from happening, why would anybody care about anybody knowing about it, especially when the healthcare system is typically what causes it? They both failed. Why we won't fail is because we produce antibodies, the same type of antibodies they were trying to produce, from an external source. And those antibodies can very safely be given orally to go directly to where the problem is and solve that problem. Now, why would our antibodies work? Well, we're right now in a phase 2 clinical trial to treat C. diff with those same antibodies. In other words, somebody gets sick with C. diff, we give them our oral dose antibody treatment, and guess what? In 94% of cases, they get better, which, by the way, is better from a therapeutic point of view than any other treatment out there, which includes basically antibiotics right now. Those are the standard of care treatments. So, our treatment works very well as a therapeutic. And so if we're getting 94% success there, why wouldn't we get the same, at least, if not better, than 94% success on preventing? It's the same antibodies. In other words, you're in a position where you might get C. diff. And by the way, that happens when you take an antibiotic treatment for something else. That antibiotic treatment knocks out your gut flora, making you susceptible to C. diff. The perfect time for you then taking our oral dose antibodies, so that if you come in contact with C. diff, you've got the antibodies there on a daily basis preventing you from getting sick. And should we get a good result? Well, we should get at least a 94% success rate by just continually taking the antibodies on a daily basis. Anyway, in our case, we've got these fantastic oral dose antibodies. We've dealt with about 130 patients so far on the therapeutic side with about a 94% success rate. In other words, we're taking those antibodies and we're giving them to a patient that has C. diff, and we're eliminating the problem in 94% of the time. That same technology, using those combination of those same antibodies, can be used to now prevent C. diff. And we're preventing an infection that kills 30,000 people a year, that makes a lot of people sick. An interesting point, if you're over 65, in the hospital with multiple comorbidities, and you get the news that you've got C. diff, your expected lifespan is less than 30 days. So wouldn't it be nice if you can actually come up with something that solves that problem? And we have it. One thing we have to talk about is safety. And in our case, that will help because our treatment is completely safe from the point of view of doing actual clinical trials. When you do a vaccine clinical trial, traditional vaccine clinical trials, because you haven't got actual patients, there's nobody that's sick yet. You're just trying to figure out, you use typically in a vaccine trial a placebo and your treatment, and you do thousands of patients, and you try to presume that your treatment arm prevents people getting infected better than the placebo arm does. In our case, because C. diff is very specific, first of all, to hospitals, that's where you catch it. Also specific to the fact that in 99.9% of all cases, you've had an antibiotic treatment previously, which makes you susceptible to C. diff. So that right away reduces the number of patients you even have to think about looking at that are going to get C. diff. So your numbers of patients required is way lower. From the safety issue, our treatment is definitely a medical treatment, but it comes in the form of a whole egg. Those antibodies are carried in whole egg. So from a safety issue, that's what it is. So when you're looking at the cost of doing a treatment or doing the trial work, which is obviously something you have to think about when you're going to put money into a new technology or a new treatment, we can narrow down very nicely the number of potential patients that need to be even screened from the point of view of does our treatment work or does it not, just by virtue of the fact that you need patients that have taken an antibiotic, and even more so if they're in a hospital. Just wanted to thank you for spending the time to learn about our novel oral antibody technology to treat, but more importantly, to prevent C. difficile infection. And I also wanted to mention that the same technology lends itself well to many other applications for both viral and bacterial infections. And we've also found some pretty amazing results dealing with gastrointestinal problems that can be related to chronic illness such as asthma, arthritis, acid reflux, and many others.